My name is Jennifer Smith. I'm an osteopathic physician here in the family medicine department. I do it all. I think my favorite thing to do is actually pediatrics. Most people think I'm the obstetrician doctor, but pediatrics is actually my favorite thing. I decided I wanted to be a physician when I was 5 years old because my aunt is a nurse, and she was graduating from nursing school when I was 5 years old, and she gave me her stethoscope because she got a new one. My personal care statement is to provide the best, complete, compassionate care to every patient every time. I try to relate to my patients by finding out what we have in common. It helps me to be able to remember each patient a little bit better. That way the next time they come in, I can ask them how was their new grandbaby or how was Christmas vacation or whatever. But I do try to find something that we have in common, makes it a little bit more personal. I advocate for my patients by if they need lab work or if I have to fight with insurance companies to get things covered. I try to go that extra mile just to make sure that my patients have everything that they need. I try to get my patients to take a very active role in their care. I feel that if you're active in your own care, oftentimes you will also be more compliant with your care. Sometimes patients want me to tell them what they're supposed to do, but oftentimes I'll give them options. This is what I think you should do, and here's the options. What would you like to do? And let them decide, because oftentimes if they decide, then they can hold themselves a little bit more accountable. I think most of my patients would describe me as a friendly, happy, bubbly, personable physician that cares about them. I think the most rewarding part of my job is when I get to give them good news. I think that's the most rewarding, is giving people good news. My professional strengths are that I'm very personable. I'm very on time. It's something that I pride myself on, being on time, because I think that the patient's time is just as valuable as my time. And I'm honest. If I'm not sure of the answer, I'll tell you I'm not really sure, but if you can give me some time, I'll do some research for you. Committed to care, committed to you, to me means that exactly what it says. I'm committed to your care, and everything that I can do for you, I will do for you. And if I can't do it for you, I'll find somebody that can. Every clinic and hospital has an electronic medical record, and we all have e-scribing, and it's more standardized now. So that doesn't really set us apart, but what sets us apart is that we know you when you come here. And if we don't know you right off, we will know you pretty well by the end.